Hello, everyone, and welcome back to my YouTube channel. My name is Tracy, as you all know, and I will be presenting information on atrial septal defect, also known as ASD. ASD is a congenital heart defect in which there is a hole in the septal wall separating the right and left atria. This disease occurs during heart development while the infant is still in the womb. However, the official cause of this disease is unknown. Plus, it encompasses four main defects, but will focus mainly on two of them, which are the ostium secundum defect and the ostium primum defect. Ostium secundum defect is caused by an arrested growth of excessive absorption of the primum septum, whereas the ostium primum defect is also affected by an arrested growth, but specifically focuses on the apical portion of the atrial septum. At birth, right to left shunting shows an increase in the left atrial pressure, which then results in a smaller volume. As a respiratory therapist, we could then increase compliance to increase the volume. And if we were to look at a chest x-ray, we would see an increased pulmonary flow with enlarged chambers. To treat this defect, the patient will most likely undergo surgery or have a catheter procedure that's taken place. According to NIH, complications pertaining to this disease include dysrhythmias, right-sided congestive heart failure, or stroke-related issues. Signs and symptoms may include tachypnea, respiratory distress, heart failure, crackles upon auscultation, infection, and so on. So as you can see that this is a serious disease that we have. And now I can even go into actually showing you my mind map. Okay, so here's my mind map on atrial septal defect, ASD. Then we can start with the background. So I kind of went into the background a little bit earlier, where it consists of a hole in the septal wall that separates the right and left atria. And then the two types, which is the ostium secundum and the ostium primum ASD. Then we get into the chest x-ray, where we have it's normal in early stages when the ASD is small and there's increased pulmonary flow and then the chamber enlargement. Our clinical manifestation consists of it's present at any age. It depends on the size and degree of shunting between the atria. And the small ASD may or may not have any signs or symptoms. Moderate to large ASD, where there's heart failure, tachypnea, respiratory distress, crackles, and infection, like I stated before. The pathophysiology, where there's pulmonary and systemic vascular resistances, compliance of the left and right ventricles. The size, at birth, there's left to right shunting occurs due to increase in left atrial pressure, which, like I stated before, results in a small volume. An increase in compliance can increase the volume. In a large ASD, the pulmonary flow to systemic flow ratio can be over 3-to-1. Our prognosis, like I said, it's unclear or unknown of how it's caused. Occurs during heart development while the baby's in the womb, can be closed surgically or percutaneously, and we want to avoid any signs of elevated right heart pressure or right to left shunts. And lastly, the respiratory management treatment, that's based on the seriousness of the signs and symptoms, the size, repairment by surgery or catheter-based procedures, and we want less risk when surgery is performed less than 25 years old of age. So that is my mind map. As you can see picture-wise, you can see where it's at. There's that hole in the septal wall separating the right and left atria. And I thought it was actually a really cool topic. It was different. I've never heard of it until now. And it's crazy to see that things like this actually happens in infants when, infant is just so innocent and you're trying your best to solve or to help them in any way. So I think that it's super important to learn. And I actually enjoyed doing this. I actually did my mind map topic super early, so it was easier to find an article. So my article specifically goes more in depth of, the same topics pretty much, like your pathophysiology, your treatments, and the different diagnoses, your complications. Like I stated, the atrial dysrhythmias, your right-sided congested heart failure, any stroke related issues. And specifically, I liked how it went into like it spoke about enhancing healthcare team outcomes. So I think that was important because that's actually how, as a team, you're determining, not only just the treatment, but you're also determining like the best outcome for your patient or any patient in this sense. And then like one thing it highlighted was that improving the healthcare team outcomes in patients with atrial septal defect requires interprofessional teams with strong input from the patient's pediatrician, primary care physician, and nurse practitioner. And you want to, it requires consistent follow-ups with cardiologists to monitor the heart structure, the heart function, and the patient's hemodynamic status. So I think in general, it's the team is what keeps, or like your team, the physicians, the RTs, the nurses, everybody come together to, help the child in this case, because it's more prevalent in children and not just infants. And I just wanted to go a little bit more in depth because I kind of explained the article itself in my summary. So things that I listed in my summary is pretty much this article. So it did help me further understand atrial septal defect. And I do have a little bit more of a clear understanding of it. This was a different topic for me. I've never heard of it. So it was just interesting to actually learn about it. And also known as it's just one of the many different defects or diseases and disorders that these kids are like experiencing at such a young age. So I can see why it's something that we need to learn, especially for somebody who is interested in like NICU PICU. So I just think that was awesome to read about and learn. Thank you for listening to my YouTube. That concludes my talk on atrial septal defect. Please like and subscribe to my YouTube channel. Thank you. Bye.